Hi, I'm Dr. Charles Lee, and today I'd like to discuss upper eyelid surgery and how to obtain a symmetric crease while performing the operation. In the first example of our patient, I look at the eyelid anatomy to ascertain how even the two eyes are prior to surgery. In this example, I'm looking at the patient's eyebrow position. I'm looking at the upper eyelid position, and I'm also looking at the size and the width of the right half of the face compared to the left half. This particular patient has a very symmetric upper eye and orbital anatomy, so that the brow position, lid position, and globe position are all very even left to right side. This type of patient is an excellent candidate and can obtain a very symmetric result without undue difficulty on the part of the surgeon. Unfortunately, this is more of an exception, and in most cases, there are varying degrees of asymmetry between the left and right sides. The next patient is more typical in the sense that here, as we check the left and right sides, we see that the right brow is a little bit lower than the left brow. We see that the right eyelid margin is a little bit lower than the patient's left eyelid margin. And you can see that the left half and right halves of the face are slightly different in size. Most of the population has the right half of the face slightly smaller than the left. When uh, when assessing patients' lid positions, we measure the distance between the pupil and the lid margin. And in this case, we see a red marking indicating the distance between these 2 points. As you can see here, the patient's left eye opens almost twice as wide as the right eye. So the right eye will need to be corrected as part of the eyelid operation so that both eyes are opening to the same degree. This mild degree of droopage is also known as ptosis, and there are varying degrees of ptosis that should be addressed as part of the double eyelid surgery. If the ptosis is ignored, then postoperatively what we would see is that the two eyes look even more different than prior to surgery. The ptosis repair is done through an incision approach as part of the double eyelid operation by tightening the looser muscle, so in this case it would be the right side, and helping that muscle be stronger so that the two sides are even. Here, postoperatively, you can see that the lid positions appear to be much more even because the right eyelid is now able to open in a much more even manner with the left side. When the degree of differences between the two sides are more severe and more tightening is required on the weaker side, you'll see more of a descent of the brow of the affected side. In other words, the brow will come down a little bit as part of the eyelid correction process. And in some cases, the amount that the brow drops can be significant enough that a brow lift is recommended. In some cases, what we notice is that the ptosis is very subtle because there are compensating tricks that the body employs in order to help the weaker eye open. One of the common things we see is that the eyebrow on one side will lift higher than the opposite side in an attempt to help open the weaker eye. In other cases, we also see patients tilting their head slightly, also to help the weaker eye gain the same amount of vision as the eyelid that opens normally. These subtle alterations in the positional uh, positional function of the head can make it very difficult to identify patients that have ptosis, and Even inexperienced, even surgeons that are experienced can sometimes have difficulty diagnosing ptosis prior to surgery. If a ptosis is discovered after the surgery, then correction is usually performed either in the first week after the operation, or a waiting period of 3 to 6 months is allowed to transpire before going in for a minor adjustment. If in some cases the lid will self-correct, and the after full healing, the lid position will be similar enough that both the patient and the surgeon find it an acceptable result,